Good afternoon, everyone. Today's topic is use of information technology and artificial intelligence. So, it is, we can say it is continuation of our Saturday's class that was basics of computer skills. What is IT? Now, information technology, it includes all the technologies that is used for processing, storing, and transmitting information. So, for processing of the information, we do use our, say, laptops or desktops. Then, for storing information, so can you tell what all devices can you use for storing information, digital information? Anything, you just guess. Pen drive, right? Then in computer also there are multiple drives where we can store our information. Then for transmitting information, you can tell something about how can we transmit information. I'm talking about digital information. Just guess something. You have something in your pen drive or desktop, so how can you transmit to other people? By USB, that is one method. There are multiple methods. Something else? By Bluetooth, right? Then, so if we have a good internet connection, we can mail them, we can WhatsApp them. There are multiple ways. One is like in physically, like you can take the pen drive and maybe directly you can attach with their computer or their desktop, or if it is in very distance, then we can do it through our internet connections, like we can mail them, we can WhatsApp them via Bluetooth. If it is inside the Bluetooth sharing zone, you can send it via Bluetooth also. So there are several examples through which we can have access to information technology, like computers, networks, then several data storage systems, and then multiple software applications. Now, what is artificial intelligence? So it is basically one part of information technology. So it is a branch of computer science which is focused on creating systems that perform tasks that typically require human intelligence, such as visual perception, speech recognition, decision making, and language translation. So basically artificial intelligence, it is a part of our computer science. Where it is not fully digital, it needs information related to human skills like visual perception, speech recognition. So with the help of human intelligence, it is, we can say it is an app or it is a module that will again generate one system that will perform multiple tasks for us. It will make our life easier actually in coming future. So there are multiple roles of information technology even in our day-to-day life. So it's actually embedded in everything that we do, our social interactions on digital platforms, to our business transactions, to our transportation, you name it, and we have embedded this information technology in our day-to-day life. Like, well, coming here also, if I wish to book a Uber car, then I have to take help of information technology. Then I have to confirm whether the location I am intended to go, I will be reaching there. How can I be sure of that my location is perfect? If I have a good internet connection, I can seek through Google Maps and I can be sure that wherever I am going in the correct place. Then this information technology, it will enhance our communication. Like I said, physically we can transfer the information through Bluetooth, or if it is inside our Bluetooth circle through pen drive or Bluetooth, we can share it. But if it is far away, let's say in another state, in another country, but with the help of information technology, we can mail them, we can WhatsApp with them. So the world is next to our corner actually these days. So by this information technology, we can enhance our communication. Then improves efficiency. Like let's say maybe 10 years back, whenever we have to send some information or some picture through internet or something, then the picture resolution won't be that good the amount of nice and neat it is these days. So whatever picture you have got it, so you can send it in the correct, in the actual JPG format, in the actual resolution. So it has been improving our efficiency a lot. It doesn't matter how much big the file is. Previously, let's say a 200 page data or 400 or 1000 of page of data will be very difficult to transmit to one person to another person. But these days, even if it is a very big book, at a single point of time we cannot have access to all the books. It is next to impossible. Sometimes we might need to go to library itself. Let's say the weather is not good, or the student is not feeling well, but then with the help of information technology we can have access to all the books. We can get it from our fellows and friends also. So everything is transferable, and the efficiency is very much good. Enables automation. Just one simple example of automation will be, like I said on Saturday, the laboratory information system. Anyone remembers what was that? Can you tell? Just laboratory information system, what was that? Any single use of that system? In laboratory information system, specifically I told that if we run one sample and the value is coming in the machine, so after that laboratory information system, it will ensure that the values are transported from the machine to our systems. So let's say in your second year you are sitting in the classroom, or you are sitting in some another room, not specifically in the lab, but you can access the reports from there. You can check whether the validity of the reports are correct or not, and you can authorize from there itself. So it has opened the doors of automation. Actually, we don't need to be physically present there. Of course, we have to judge whether the sample has been run correctly or not, but now automation is it is very close to us with the help of information technology. Okay, is it? Then it will help us in supporting complex problem solving. So sometimes there will be multiple apps based on whatever problem we are thinking of. So then those apps, they will guide us. Let's take an example of there can be some apps where all the routine parameters, they will put it like let's say sodium value, potassium values, creatinine values. So after we put the values of a particular patient, if the app is modulated like that, if it recognizes that the values are over the reference range, or they are crossing the critical value, it will automatically inform the patient that your values are critical and you need to consult with your doctor very immediately. So those things, those complex problem solving solutions, we will have access through our information technology. Now, what are the key components of information technology? Like Saturday also, I talked about hardware, like physical components like computers, then servers, then networking devices, like pen drive is one of the networking devices. Then in the software, we have separate many operating systems, applications, many databases. Databases in the sense, if we wish to access the databases of, let's say, about the pregnant women in India, how they behave, how their hemoglobin behave. Then in pediatric population, we can access that their in pediatrics, like how much length, height and weight they should have over their age. Like in 2 years, how much growth we are anticipating, in 3 years, how much growth we are anticipating. Like that, several databases are there. So we can compare our patients' data with those databases, and we can understand whether it is the whether we are comfortable with this one, or whether the kid needs a special attention from a pediatrician, that he or she is not growing how much he should grow according to his age. Okay. Then several networking options like internet, intranet, and then other data transmission systems for data management, collection, storage, and retrieval of information. So data we can collect. So most of the time we have to put the information, put the data in our system. So do anyone remember where all we can, which is the most preferable app for whenever we are having multiple data? Which was the app in computer? Huh? Microsoft Excel, very good. So there will be multiple of like that apps, but then Microsoft Excel is one of the easiest that we can learn very quickly, and it will help in sorting our data, in collecting and saving our data nicely, so that whenever we want any special things, because in Excel sheet there will be multiple of information. You want to access, let's say suddenly your guide or your principal investigator is asking you that you have collected thousands of pregnant women's data. Just tell me what is the youngest age. So in just single click, you can tell her. You don't need to search all the 1,000 sheets. In a single click, you can tell that in your sample size, what is the youngest stage or what is the oldest stage, like that. So for data collection, data storage, we need to, basic skills we need to acquire regarding the Microsoft Excel sheets. Then retrieval of information, it is a bit complex. So whenever our computer gets hanged or it is shut down by chance, then we'll take it to our computer engineers. Then they have some programs or some apps where most of the time they can retrieve the information. Now, knowing about the impact of information technology in our society. Yes, sure. So like I said, information technology is embedded in our day-to-day practice. Just for some examples, like in communications, I told emails, we can WhatsApp them. Then social media and messaging applications have transformed our communication system these days. Anywhere in the world, we can put a message, we can put a mail, and just you click the send and they are going to receive it if you have a stable internet connection. If the sender and receiver has a stable internet connection, processing or sending the information just one click away. Then for business, right, digital transformation enables online marketing, data-driven decisions, and global outreach. So for healthcare, that is the most important for us to consume, that what is the importance of information technology and artificial intelligence in healthcare system. We are more concerned with this in this seminar. So for healthcare, digital health records. So that is very important. I told Saturday also. So one of the example of digital health records is hospital information system. So any one of you remember? You tell something about the hospital information system. Next side, second group. Tell just one or two topics. Hospital information system. How will it help us? If you can remember. Hmm. So any patient is coming, right? Sure. And anything else? Like sometimes say their data also will get at the end of the month. Sometimes we will wish to know that how many cesarean sections were done. So just one click, you can tell that last month cesarean section data is 30 or 40 or whatever number is there. Then how many pediatric patients visited in your OPD, how many obs-gynae patient visited in your OPD. So there are multiple of data. So if we store it in a digital way, we can access it very quickly and we can understand it very quickly. So how will it help if we can understand these data very quickly? You sit down, please. So once we know that these many patients have visited our pediatric unit in a month, so for the next month, we can prepare like that expected patient visit will be 30 or 40. So how many doctors are needed, how many staffs are needed, so that from next month we can do better care for the patient. Similarly, let's say for cesarean section, so how many cesarean section were done, then for any routine surgery, how many cholecystectomy were done. Cholecystectomy is the procedure which will remove the gallbladder from our body. So for planning the next month, The previous month's data is very important, and it is more so important in our settings because we are a new hospital, new college, so we need to plan it way before we are actually doing the work. So for better planning, digital records holds utmost importance. Then in healthcare sector, one direct example of information technology is telemedicine. So one of you tell something about telemedicine, whatever you know, just in one or two lines. Telemedicine, have you heard the word before? Okay, then girls, you tell. Telemedicine, have you heard the word before? Never? Okay, so telemedicine mostly it came into picture in COVID times. Previously also it was there, but during COVID times actually it came into light. So sometimes in rural areas, there will be many patients, those who don't have access to that much health care. So through telephonic conversations, their complaints, whatever complaint they will have, they will tell that complaint. And the doctor who is answering those calls, they will try to help them as much as possible. Like they can prescribe any urgent medicine, or they can prescribe any urgent test, or if not test or medicine, they can guide that this patient needs urgent referral or urgent admission, and others they can wait, let's say in diarrheas. So if they have some danger signs like they are not passing urination, or they are not sweating, they are not able to drink any even the ORS, so at that time they can guide that you need urgent admission, like that. Or some of the diarrhea patients, they are telling that I am having diarrhea, but then I'm able to drink the ORS liquids. So that time they can, in through telemedicine, they can guide that, okay, you try to consume as much ORS as you can. If you feel you are getting healthy or comfortable by 4 or 5 hours, maybe you don't need to seek urgent medical attention. You can rest and then you will be recovered eventually. So then, in healthcare, information technology has produced many health apps also. There are many health apps these days, like I said Saturday also. Some of the apps, they will determine your body mass index. So any normal person, they can have access to those apps. They can put their data on their weight, on their height, and they will get to know how much is their body mass index. Also, according to the grade of body mass index, they will know what they should do, whether only lifestyle modification would do, whether they need any medicine, or whether they need further evaluation for their increase in body weight, like EGFR calculator. So many apps are there for females also, that at what age, pep smear, any idea about pep smear? So that is a screening test, basically to ensure that the lady is not suffering from cervical carcinoma. So it is a screening test. So in many of the apps, it will tell that what is the correct age for that lady to undergo a pap smear. So basically all these health apps, these are made for prevention. So once you are suffering from any illness, that you need, then you need to seek medical attention. But for prevention, that so that we don't suffer from that medical illness, so basically those apps are for preventive measures, so that before getting sick, the individual knows that where he need to do lifestyle modifications, or what all testing he should done beforehand, so that he doesn't become too much sick. Now, again, definition of AI. So AI involves creating systems that can learn from data, adapt to new inputs, and performs tasks intelligently. Like just one example for artificial intelligence. So let's take example of so I'm talking most about pregnant women. So we need, let's think that we need to make one system, one artificial intelligence based system, where we'll put abundance of data in that system. Data in the sense that in first trimester, any idea what is first trimester, second trimester? What is that? First trimester, right? Very good. So we can put information like in first trimester we expect the hemoglobin to be in this much, this to this range. Okay, in second trimester this to this, and in third trimester accordingly. So we can create one system where we have to feed the artificial intelligence that this is my ranges. So whenever any antenatal lady is downloading that AI based app, and she is testing her hemoglobin level every 3 months, and she is putting her values in that app. So that app, if we can generate that app like that, that once she is once her hemoglobin is below the normal reference range, that will give her the indication that your hemoglobin is coming low. So you should consult your gynecologist, or whatever iron tablets were given to her, she should consume them very diligently. Okay. Now there are multiple subfields of artificial intelligence. The first one is machine learning. So what is machine learning? So this is teaching machines to learn from data and make decisions based on patterns. So this is exactly what I told few minutes before. So in the first step, we'll teach the machines, we'll teach the AI, we'll teach the system that this is my data, you teach it from us, you know it from us that for pregnant women, first trimester, hemoglobin should be within this range. So in the first step, it is machine learning. Then it is deep learning. What is deep learning? This is an advanced form of machine learning using neural networks to process complex data like images or speech. Like this is an advanced machine learning. So in usual machine learning, usually the data is written, so it is in Word format or PDF format. But for deep learning, it will we have to taught the machine regarding various images or various speech patterns. From that, the machine will learn that okay, this image, if I get this image, then I have to give output like that. If I get those speech patterns, I have to give output according to that image pattern or speech pattern. Then the third field is natural language processing, also known as NLP. So this artificial intelligence is focused on understanding and generating human language, like language translation apps or voice assistants. So language translation apps means nowadays you will see in the Google also, if I say something in English and if I guide it to translate it in different languages, it can do it for us. So like that, this is natural language processing. Now, some real world examples of artificial intelligence which we do use in our day-to-day practice. So, one is chatbots, that is automated customer support via text or voice. So, many a times we'll see now whenever we are putting one message, so at the same time we'll get reply from that one. You have seen in any app. So, whenever we are opening one app in the maybe most probably in the below part there will be one icon like just ask us or something like that. So how are they doing? So definitely someone is not sitting there and answering to our messages. So how do that machine knows that what question I'm going to ask him? So whoever has made the app, what they did is multiple possible questions what all I can ask them, like that they have feed the machine the questions and what should be the answer. And sometimes you will see that sometimes they will write messages that I'm sorry we cannot help you, or maybe you call the customer information. So even if they have feed thousands of questions, even after that human brain will ask some questions that is already not fed there. So that time they will ask that you need to talk directly with the customer support system. So like that AI is actually generated. So first is machine learning. So we tell the machine that you are having one app like regarding this one. So these are thousands or lakhs of questions that we are anticipating that your customer will ask you. So all those questions they will feed it to the machine and possible answers they will make. So if the question is matching, that automatically just with our click, that whenever we are asking question, they will be keeping their answers. Okay. Then there are virtual assistants, Siri, Alexa, and Google Assistant. I'm sure all of you know this. Then just one example, in virtual assistant also, whenever we are moving in car, even in the Uber cars also we'll see. So they will have this virtual assistant also, where we'll just put the our location, and then they will guide us that go right side, go left side. No one is sitting there no for 24 hours for guiding us. But so this is the interesting thing of artificial intelligence. So every routes they have feed on the machine. So that's why they know that from whenever, whichever place you wish to go to, whichever place, they have the routes. So they will guide you. So go by right side, go by left side. And also interesting thing is that sometimes you will see, so according to traffic congestion, they will, change your route also. So how they are doing? So there is the thing where they are incorporating information technology with artificial intelligence. So in AI also, you can never predict that which time, which route will have too much of traffic. So this is actually 24 hours communication from information technology. So this is live feed. Live feed they are taking that from, let's say from point A to point B, there are 3 or 4 routes. So whichever route at that time point of time is having congestion, they will guide us through the different routes. So there we can incorporate information technology with artificial intelligence. Now another example is in predictive analytics. So AI based systems that predict market trends, customer behavior, or even diagnose medical conditions. Now the synergy between IT and AI. So how these two are working in synergy. For data collection and storage, like I said before, the information technology systems will collect and store massive amounts of data, which is essential for training the AI models. The data is actually huge, it's very huge. So all the data, it will fit to the AI, and then whatever question we are asking it, it will give us reports. Then cloud computing provides scalable infrastructure for running AI algorithms and deploying AI-based services. So I was talking about 2 algorithms that day. One is body mass index, one is glomerular filtration rate. So basically these two are the easiest algorithms that I can say. So there are many complex algorithms are there. So for those complex algorithms to work precisely, work correctly, so we need a that much scalable infrastructure that only information technology can provide us. So in if we think of healthcare, the application of IT and AI, so AI can diagnose diseases also. Of course, it has some fallacies also, but in a usual scenario, it can diagnose a disease for us. Like I told, let's say for even for diarrhea also, there will be 4 or 5 points, whether the patient is passing urine, whether the patient can drink the water or he is not even able to drink the water. So by that AI can make one more that okay, this much is tick, this is not tick, then he needs special medical attention, or maybe we can treat him in the home based therapy also. He doesn't need to get admitted in a hospital. Like that, it can diagnose disease also, it can recommend treatment also sometimes, like whether he will require ors is sufficient for him, or he or she needs to get admitted for the salines, normal saline or ringer whatever is that. So it can recommend treatment for patient also, and it will improve patient care, of course, via telemedicine, because every time the patient in a rural community cannot get access to direct health care, or sometimes doctor patient ratios are also less, like one doctor for many thousands of patients, he cannot physically be present with all the patients. So those things, it will definitely improve patient care also. And information technology enables telemedicine and health records management, like we have discussed in hospital information system. So the data management, data storage is much easier rather than storing it in a pen and paper method. For education, this personalized learning experiences and automated grading systems. So once you are in your third year or final year, there are many grading systems. So from second year, whenever you are starting your clinical posting, so there is one GCS, that is Glasgow Coma Scale. Okay, so there are three sorts of points are there according to whether the patient can open his eyes, or what is the reflection when we are giving any command to the patient. So there are many gradings are there. So in any carcinomas you say, there will be staging and grading. Then this Glasgow Coma Scale. So multiple gradings are there. So through AI, artificial intelligence, so these grading systems, we can do automations. We can bring automation in those grading systems. Again, finance and manufacturing, so these are not that much important for us, but definitely IT and AI, information technology and artificial intelligence has their domain on finance and manufacturing also. Now, there is many ethical consideration and challenges even if when are using information technology and artificial intelligence. So every good thing comes with some challenges also. So with the extensive use of AI and IT, the potential for data breaches and misuse of personal information will increase. So we have to do it safely, and importance of secure data storage and ethical handling of user information is also very important. Again, coming to the role of information technology in healthcare, like we have discussed digital records, telemedicine, and remote monitoring. So, what is remote monitoring? Any example that you can remember now? Remote monitoring, let's say ECG monitoring. Okay, so in urban areas, you cannot provide a cardiologist 24 into 7. There are no, because our doctor patient ratio is still very much less. So maybe from remote area, if there is any ECG monitoring, and in a tertiary care hospital, one cardiologist is sitting, maybe he can see the ECGs and he can guide that when it is urgently he needs medical attention or it is not that urgent. So those things are also very important. Okay. Then again, these subfields I have discussed, again I am discussing machine learning. So identifying patterns for predictive diagnostics. Like I said that this all those apps which are based on AI, mostly they are important for prevention of any health diseases, those preventive health strategies. So those preventive health strategies, they will have a they can predict whether they need special medical attention, urgent medical attention, or maybe they don't need it that much urgently. So for those predictions, this machine learning is important. So we can identify patterns and we can predict for the patient whether he or she needs urgent medical attention or not. Then deep learning, I told that was based on images or speech recognition. So radiology, pathology and image based diagnostic. So what we'll do, let's say basic pathological diagnosis. In the second year when you come to pathology, you will see basic blood smears, that is peripheral blood smears. So there are various apps these days where thousands of peripheral smears have already been uploaded. If patient is having iron deficiency anemia, so we'll have this sort of blood picture. So like that, hundreds or thousands of pictures are already fed in the machine. If the patient is having bleeding, if the patient is suffering from malaria infection, that time there are some changes that we will see inside the microscope. So like that, someone has clicked the pictures and uploaded thousands and lakhs of PVF pictures. So whenever in rural area where you cannot provide pathologist, again 24 into 7 because of this deranged doctor patient ratio. So mostly there will be some laboratory technician who will see the smear, and if he or she is suspecting that okay, this can be a malaria infection, he can click the picture, he can upload it in the app. So if that picture is matching with those thousands of pictures that we have already fed with the machine, then he can diagnose, or at least he can guide that I have seen hundreds of smears. Among them, 4 I am having confusion. These 4 patients might suffer from malaria. So these 4 he can check with that AI based app, or if he needs help he can contact with the pathologist, and then they can diagnose the patient and provide the patient the urgent medical care for malaria whatever he needs. Similarly, in radiology also, sometimes any mass abdomen, or say any in rural areas, chronic smoker patients, so they might have a mass in the chest x-rays. So even if CT scan and MRIs are not available in rural India, what we can do that we can provide one X-ray machine that is not very difficult, and X-ray technician will be there, so they will get the X-ray. Similarly, thousands of X-rays are already fed on AI based app, so they can compare whether whatever lesion I am getting, one extra shadow in right side or left side of the chest, they can compare it with the AI based app, and they can guide the patient whether he needs to come to the tertiary care hospital or whether he doesn't need it. So like that, machine learning and deep learning, they have a huge aspect in the coming future. Then for natural language processing, so AI can analyze patient records. Patient records that I told about hospital information system. So whenever any patient is visiting our OPD, he will have a unique ID. Okay, let's say he this time he came with urine infection. Okay, so we tested his urine infection. So whatever infection, which organism, let's say Pseudomonas aeruginosa. So it is one organism that usually cause urine infections. And we can do antibiotic sensitivity, that in urine only, that whatever antibiotic he will be sensitive and whatever antibiotic he has become resistant. So this time, let's say he is suffering from Pseudomonas aeruginosa infection, which is susceptible to meropenem. Meropenem is one group of antibiotic that you will know in your second year. So his physician will treat him with meropenem injection, because we have report that he is suffering from urine infection which is sensitive to meropenem. So this time he has recovered, there is no infection, and you have discharged the patient. Again after 1 or 2 years he is visiting with similar complaint, fever, burning, icturation, like that. So just because in the HIS system he is having a unique hospital ID, so once we click that ID, we know his past medical history. That last year also, around the same time, he has suffered from urine infection. He had suffered from Pseudomonas infection. So whenever we are testing the second time, we basically have an idea that we expect to get a urine infection. And last time, whenever we gave meropenem, so he responded to that treatment. Definitely, we should do urine culture and sensitivity this time also, but it will guide us. So this analyzing patient records, these also we can do it better by AI based approach. Same thing, AI in radiology and medical imaging. So AI can identify any anomaly in X-rays, MRIs and CT scans, because in that machine multiple findings are there. So same thing is very helpful in our preparation time also. So in NEET UG or NEET PG, whenever you are preparing, no, you are taking help of any app. So from where did they get so many pictures? No, sometimes picture based questions are also coming. So someone have certain feed the machine with all those pictures, so that during learning also these are important, for diagnosing also, for real patient diagnosing also these are important. For pathology, assisting pathologists in identifying malignancies and predicting patient outcomes. Then there are some virtual health assistants, like in any app, in health-based apps also, sometimes these chatbots are there for initial diagnosis, mental health support or administrative tasks. Then predictive analytics in patient care, anticipating patient deterioration. Like I told, if someone is suffering from diarrhea, when he or she is getting deteriorated, so that he needs the special medical care. And in managing chronic illnesses also. Sometimes in cancer patients, where we give palliative therapy. Palliative therapy means whatever complaint he is having, some days he will have fever, some days he will have some urine infection. So we will treat only those complaints. That means his cancer per se has become incurable, but whatever life he has got, we intend to provide him the best medical care. So in those managing chronic diseases also, another example can be diabetes. So someone is suffering from diabetes for 20 years, or he or she is taking some insulin. So the diabetologist that he is consulting, they might have some app where every 1 month or 2 months he needs to check his fasting blood sugar level or postprandial blood sugar level. So he will put the data, whatever the values he has got, and the app will direct him if he was taking insulin 10 units and his fasting has come higher than the normal range, the app can guide them that you should increase your insulin dose from 10 units to 12 units. So like that, for managing chronic diseases also, AI based apps are very important. So how information technology and artificial intelligence complement medical practices? Data driven decision making, like integrating patient data with predictive models for personalized treatment. Like I said, in diabetes patient, in chronic diabetes patient, that app will integrate the data on fasting blood sugar or postprandial blood sugar, and it will predict to the patient that your blood sugar level is increasing, you should increase the dose of your anti-diabetic medication. Now it might be oral medication or it might be through insulin. Then critical workflow optimization, automating repetitive tasks and improving patient management. Some patients will repeatedly need to test their fasting level, postprandial level. So those automatic blood tests, so through those reports, the AI can guide the patient that when is the right time that he or she should seek medical attention urgently. Then enhancing medical research, identifying trends and patterns in large scale data sets. So this is important for community medicine approaches. So when you go to a community and you try to address any communicable issues, like sometimes dengue fever comes in Tripura, no? In some of the months, the incidence of dengue is huge that time. So that time also we can identify trends like last year. So whenever we are anticipating increase in dengue in 2024 or 2025, so we can always access the previous year's data, that what were the location where dengue was too much evident, and then during what time of the year. So that policy makers or whoever is in the government who are making the policies, so they can prepare before time. Like in our hospital we can also prepare before time, so if we have that data, so securing the data and saving the data is very important, so we can better plan it for the next time. So whenever any medical emergency is coming, we can plan it beforehand. So we can identify trends and patterns in large scale data sets. So again, same thing for radiology, all those scans, for pathology, those histopathological samples or the peripheral blood smears. Cardiology, these AI-based apps can sometimes analyze ECGs also, and they can detect arrhythmia. So if they find anything suspicious, at the same point, they can guide the patient to visit some cardiologists. So in oncology also, oncology means which department? Cancer department. Very good. Now these are multiple platforms that some platforms like IBM Watson Health platforms are there. So it is known for its use in personalized cancer treatment recommendation and clinical trial matching. So what is clinical trial? So usually it is practiced largely in abroad. So whenever any new drug is coming, so we cannot give the drug directly to the patient. There should be enough trials which will support that this drug you can prescribe to this sort of patients. So this clinical trial, they will go on and on for 3 years, 4 years. So in those abroad, in those Western countries, for whenever let's say any patient with lung cancer has come, so from AI based apps, they can know that for a lung carcinoma patient of this age, whether any trials are going or not. If any trials are going, they can incorporate the patient in that trial. Then one path AI app is there that will enhance pathology diagnostics by automating slide analysis to improve accuracy and efficiency. Means we will analyze the slide and we can take pictures and we'll compare with that app. So in that app, there will be multiple divisions. Like if you are suspecting malaria, you can see those pictures. There will be thousands of pictures of malaria patients. So whenever you are suspecting any malaria, you can click the pictures and you can upload there. If it is matching, the closest match, they will show you that, see, this picture is matching with your finding. So most probably this is this sort of malaria. Then again, we can confirm from our pathologist. So the same challenges. So data privacy is very important. Clinical accountability means despite artificial intelligence assistance, physician must remain accountable for patient care decision. Every time it is not like AI will guide and it will be correct. So there should be someone who will monitor all the decisions that has been made by the artificial intelligence based apps. Then sometime there can be bias. So sometime one app that can be made in, let's say, in London or something, so before incorporating that app in Indian or Asian population, so we must ensure that there are no biases. Like for example, AI trained on predominantly Caucasian data might underperform in diagnosing skin diseases in patients with darker skin tone in Asian countries. So even if it is AI based or IT based, we must be very vigilant every time that we are taking the correct decision. We must ensure that the AI based apps are working correctly at the end of the day. Thank you.